All right. So at this point, we will move into the panel discussion. And the way that this is going to work is basically the planning committee will be part of the discussion with the speakers that we've had, the 3 speakers that we've had so far. And then this will just be, as I say, just a general broad-ranging discussion to sort of get at the heart of the matter. I think these talks were all beautifully connected, and so, but there's still, some gaps in what we know. And what we'll do is I will call on members of the planning committee first. They can raise their hands with questions, and we'll start there. While that is happening, if questions arise from the audience, those can be typed into the Q&A section for the people that are participating outside. And then those will be filtered to me via the chat window, and I'll read those questions. So panel members have access. I will actually ask you to unmute yourself and ask the question directly. I will read the questions in the chat from the general audience after we go through the panel discussion. Okay, so having said all that, I think what we'll do is we'll start with, as I say, the panel, and I'm looking for hands. That's the challenge. Are there any hands that are up? I know that I have a question from Elizabeth Matsui. Would you like to start off with a question?
Sure. I loved those presentations. They were terrific. I learned a whole lot. I sit in the position of a clinician and someone who thinks about health effects of variety of environmental exposures. And what struck me was the complexity of the outdoor sources, the penetration of the emissions from those outdoor sources indoors, and then the chemistry. And what I'm interested in is, how do we know, or do we have a framework to prioritize how we might go about identifying the best targets for mitigation, and how to prioritize those targets? And I think I'd be interested in any of the 3 speakers' comments, but in particular, Delphine and I think Scott's talk were probably most relevant to this particular question. And I'm sorry, Brent's talk.
Well, I can start with a few thoughts on that. I think it is the outdoor atmosphere is very complex, but we understand a lot of underlying fundamental principles about it, and so we do know a fair amount, especially when we start thinking about the chemistry occurring on regional and global scales. When you start getting into the really local level that Dr. Ivy was talking about, then I think we have open questions. The infiltration component, I'll leave to Dr. Stevens, but I think when we start thinking about general guiding principles, we want to think about those underlying chemical and physical processes and then start applying them to indoor environments. So I think it seems like a challenging problem, but it's maybe not intractable.
Yeah, and just to build on that, and I'll leave it to Delphine and Sunny to think about, well, you could eliminate or reduce, outdoor sources as a primary angle. When you get to the kind of the threshold between outside and inside, I think I think there's a little bit of evidence in the literature that factors like air conditioning usage modify some of the outdoor air epidemiology associations with PM 2.5. So that sort of suggests that filtration helps, or maybe newer building stock helps because it's more airtight or something. It's not immediately clear, but there's this sort of mantra in the building science world that is build tight, ventilate right. And the idea is that as you build buildings, you try to seal uncontrolled air leakage, but then you make a building so tight that indoor sources become important, as we'll learn in the next session. So therefore, you've got to ventilate. Well, then if you ventilate, you've got to then kind of turn to products and that filter pretty well. And there are some simple ways to do that. And there's also kind of a lack in the marketplace. There's not a ton of companies who make for example, energy recovery ventilators for homes that have like excellent gas and particle filtration on the intake. You can incorporate them into a central HVAC system and do better filtration there. But luckily, none of this is rocket science. It's really just about priorities and incentives, I think. And then how do you address the existing building stock is a real challenge. First of all, we don't even understand it that well. And then how do you address it is another issue.
Does anybody else want to follow up? That was a good question. It looks like, Renji, are you going to ask, are you popping on to ask a question? Oh, that works. Okay, the hand and everything. Okay, we're getting it. We're getting it. Okay, I will move to Renji. Would you like to ask your question? Thank you.
Sure. I kind of have a follow-up question. Brent mentioned that the reducing air infiltration as a mitigation strategy. Do you think we need more research to demonstrate efficacy from air sealing? And if so, kind of what are the main challenges? I think Suni kind of touched on that too, that the housing stock make a big difference. Building envelope is an important component, but how do we make that to a practical mitigation? Do we need more policy into helping homes to air seals? What are your thoughts on that?
Yeah, thanks, Renji, and good to see you. And I know some of your work on the societal sort of impacts of doing these kinds of measures is really useful for informing. So, you know, I cut my last slide that I cut for time was showing some unpublished data from a student's dissertation, Howrand's, looking at infiltration factors before and after energy retrofits. The interesting thing was they weren't hugely impacted, in part because meteorological conditions vary, and that can be hard to control. And in part because the variability, there's a lot of variability in air sealing. So we were able to get into maybe 12 homes that were all pretty old that got air sealing retrofits. Some of them barely got any tighter because they got the easy retrofit, and then some of them got as much as 40 to 50% tighter. And so there's high variability, as you guys know, there between deep and sort of light energy retrofits. And so I would say that, like, if I had to make a decision, yeah, I think it'll have a big impact. Do we have like exquisite data showing that? No, not quite, because the methods I talked about have been applied in, you know, some homes, and that hasn't always been overlapped with the retrofit home. So I think we could see more there to see what we think we would see, and then see if we see any surprises.
I have a follow-up on that, because when I hear, I've been pretty heavily involved in this crazy pandemic that we're in the midst of. And so when I hear you say seal the building, that goes against all the advice we're giving people about ventilate, ventilate, ventilate. Like, you know, that we finally got WHO to say ventilate, CDC saying ventilate. That's the way we don't rebreathe people's air. And this is, you know, so I get, you know, I realize that, you know, one of the things we were up against is, you know, because of energy considerations, you know, the push has been to seal the buildings, right? But then that has been a bit of a challenge in dealing with these viruses. Which do you want? You want to breathe the outdoor air, or you want to be exposed to, you know, the virus? And so can you comment a little bit on the trade-offs and how you would balance the needs?
Yeah, I'll just jump back in there, not to dominate that, but I thought the LBNL work from the single test house, where you tested what, like 13 different types of configurations of ventilation and filtration. It was really interesting, in part because it's intuitive, right? And I love like intuitive results. Where supplying air with a pore filter, that's great. That's going to take care of indoor sources no matter what. But supplying it with a pore filter actually increased indoor exposures to outdoor pollutants and outdoor PM. Supplying air with an excellent filter, in a way, like commercializing, if you will, commercial buildifying residential buildings, then all of a sudden have the lowest infiltration. So I think it's quite possible to do more ventilation, but more filtration of that air. I would also mention that this anecdote that I like to show from a paper in 2012 that we published. We were out in Austin making these measurements of particle penetration into people's homes. And what's really wild.
Okay.
Oh, am I lost? Did I have video problems?
I can hear you.
Oh, Kim, we might be losing you.
Uh-huh.
Uh-oh.
Okay, did people hear Brent, or was it just me that missed Brent?
I
Sounds
think
like
I could
they
hear.
me.
Yeah,
I
you
think
can
it's
hear
just
Brent.
you, Kim. Yeah.
It's me?
It's
Am
just
I the
you.
one that's breaking up? Oh. Great, as a moderator. Okay. Uh-oh. I may have to have Rich take over. Mine is going slow. Is
I
it?
think while we're figuring that out, I just want to add into what Brent was saying in terms of this trade. You know, there's this sort of long story of a supposed trade-off between energy efficiency and indoor air quality, and I think there's a little bit of a false dichotomy there, because there's a lot of emerging understanding of ventilation and of filtration, the use of portable air filters, but also just a really well-designed ventilation system. So I think I just want to note that Brent started out noting seal the house well, but then ventilate smartly. And I think that part is really important to remember when we talk about this.
Hey, Rich, did you want to chime in?
Yeah, so this is for all three of the speakers. Brent, you talked about the impacts of better filtration versus worse filtration. Mentioned portable air cleaners, but for all three speakers, can you perhaps put your presentations in the context of how there's differences between marginalized and underserved communities with respect to being able to reduce their exposures from all of these sources relative to those that have the resources to actually purchase much more expensive filters or good portable HEPA air cleaners, et cetera. I think this is a thread that we should probably have touching all of our presentations and every one of our sessions. So just leave it to each of you to maybe comment on that in the context of your presentation.
I can speak on that. I think it's a wonderful question. It's it's an honest question in that communities and residents that may not have the resources to bring in outside interventions, it is important for us to get creative about how we can leverage policy. And I see that there is a recommendation for using a program like Medicare or Medicaid to make interventions more prescribed, especially for health. And I think we need that help. This needs to become a systemic intervention, because the causes of disproportionate exposures are systemic. They're not individualized causes. So in order to fix a systemic issue, you need systemic solutions.
I'll follow up on that. I think it's such an excellent question in terms of the sort of question of how we deal with environmental justice in the indoor environment and the air we breathe permeates all of the components that we talk about. So I think outdoor particulate matter is one that is really difficult because it's not necessarily in an individual's control. Right, as I think Dr. Ivy beautifully showed in her presentation, there are other factors that influence the particulate matter, and so I think that's one place where we as a society need to think about those sources, but we also need to understand exactly what those sources are and what they're contributing and what the chemistry is. But I think when it comes to building design and products, there's a lot of opportunity to improve, to decrease particulate matter and improve indoor air quality. But a lot of those both cost money, which is one issue it's a socioeconomic issue, right? Wealthier individuals may be more able to make the retrofits or purchase personal air purifiers. But there's also a component that I think is information-based, and that there's a lack of clear guidance and information about what different technologies, how efficient they are and what they do. And I think one really useful example of that is this rise of air cleaning technologies that involve oxidants or ions, and those do that chemistry that I talked about occurring in the indoor environment. And so there's a lot of potential for unintended consequences. And so I think both from a financial and an information and education perspective, we as a scientific community need to perhaps be a little more clear and more active in communicating with different communities, and not just a few select few.
Okay.
Yeah.
That was great. Okay, so I'm going to switch over. I'm getting we're getting quite a few questions now coming in from the audience, and so and I'm going to sort of blend them with questions that I had. And a big one that is coming up in various ways, we'll just start with this one, has to do kind of with what is the best metric. You know, you talked about, you know, there's indoor sources, outdoor sources. You can look at PM 2.5. You can look at ultrafine particle counts. There's all different kinds of metrics. And this question says, basically, Dr. Farmer showed results from home chem and lab studies that show production of oxygenated organic compounds from VOCs post-bleach. The change was very small in terms of mass. What do we know about health effects of PM exposure with total mass of PM inhaled versus the size of the particles? Small particles can be numerous, but weigh very little and have different deposition. This just gets at this issue that we have, you know, sort of a PM 2.5 standard for outdoors, but what would be the best metric for indoors from your perspective? And I'm asking this, if all of you can comment on that, I'd be very curious.
Yeah, I think the challenge of coming up with standards is you need to have enough information to be able to know about what levels people are exposed to, what sources one can actually control, and then what those health effects are. And I think in these strange compounds that we produce, for example, through bleach cleaning, we see this huge array of sort of very oxygenated molecules, halogenated molecules. Now, some of those show up as air toxics on the OEHHA or hazardous air pollutants databases. Other ones are more modeled or predicted to have health effects. And so that science is emerging. But there's also, I think, in terms of ultrafine particles, there's a growing body of evidence that these really, really tiny particles can certainly penetrate into lungs and have health effects. But my sense is that a lot of the questions of regulation or guidelines or levels should be guided by the precautionary principle, the idea that we should first figure out that things are safe and be more cautious in terms of how we set guidelines or what we do. So I think the science is there. It's very clear that it shows that particulate matter has negative consequences to human health. And the science is also clear that there are dangerous compounds in the air and that can be produced by chemistry, and that some of those also have negative health effects. So from there, I think we can use that information to start to develop guidance. But I think more research is always useful. But I think we can rely on what's established in the epidemiology and from the outdoor air literature. But Drs. Ivy and Stevens might have additional perspective.
Yeah, I would just chime in to mention that to some extent this is a little bit of a blind spot in how we can handle things. So I'm, you know, we often use PM 2.5 as just like this blanket measure, right? Because compositional and size resolution underneath that is so much harder to get that data, and so therefore at scale, right? So our epidemiology studies like struggle with that. So if you just look at ultrafines, right, the number of epidemiology studies between outdoor ultrafines and some health outcome is like what, tens? There's tens of those maybe, while there's thousands for PM 2.5 because of our monitoring frameworks and regulatory frameworks. So something that I saw some work from the Center for Nanotechnology and Nanotoxicology at Harvard several years ago, where this process I thought was really, really quite intriguing, where essentially a group determined that, you know, laser printers and photocopiers, right, we know they emit lots of particles. Well, they went into a copy center and sampled those particles and show that signal. Okay. And then they did sort of toxicology, cell level and mouse model types of studies with those collected particles to see what sort of reactions there were, sort of impacts there were at that level. And then they did some like biomarker testing in human subjects. And that, like, closing the loop, I mean, it takes a tremendous amount of resources. And I'm only talking about copy center particles, right? To kind of do that. But that framework I thought was really kind of elegant and might help push us toward a better understanding of these kind of competing effects of both indoor and outdoor sources.
Thank you. Sunny, do you want to?
Yeah, I had one comment about trying to think about new standards. I think perhaps we could shift our perspective a little bit to think about where are the greatest disparities? Who is most negatively impacted? And how are they most negatively impacted? Because we are only as strong as a society as our quote unquote weakest population. And so a taking more survey in the communities that have the highest exposures, that are surrounded by the sources that are potentially leading to cancers that wouldn't be there, we should probably start there and build standards to protect the people that are most vulnerable in our society.
I'd also like to add to that, though, and say that this sort of sense of indoor chemistry and what is actually in the air is really new. People have been thinking about this for a long time, but the sort of new technology that we've had in the outdoor atmospheric chemistry for a few decades now has only very recently been brought into the indoor environment. So we're constantly learning about new components. And I think that one of those pieces, though, is that we've only been able to look, they're very hard measurements to look at all these individual molecules and the chemical composition of air. We've only been able to do that in a few test houses in a few or a couple of locations. And so I think that there's a lot of room to start thinking about what are the chemicals in the homes, but I think we have to link it to what Dr. Ivy just talked about in terms of thinking about the most vulnerable communities and those disadvantaged ones, because right now it's a lot easier to make measurements in communities where the infrastructure is already there or it's already established. So I think there's a lot of room to start thinking about these higher end chemical measurements and really linking that to health effects, but doing it in the communities that need it the most.
Yep, that's great. Thank you. Okay, so this question is kind of directed at Brent from part of his talk, but also others. What criterion are people focused on in terms of quantifying the infiltration / health intersection, the time integrated exposure or the instantaneous maximum exposure? So this has to do with time scaled.
That's an interestingly specific question. I would say that the literature shows a little bit of both, but the most robust associations I think that we build on in terms of health outcomes are kind of long-term exposure for PM. So I think most of the modeling efforts tend to assume time average / long-term, particularly of outdoor origin. I've seen a lot less on kind of the daily component or even shorter time scales. Although there's a slide I wanted to incorporate here, but hopefully someone will touch on later, is like there's been literally a handful of efforts to try to see if infiltration is a modifier of the effect estimates between things like emergency room visits and outdoor PM 2.5, for example. And those tend to be on a short-term basis, not a long-term basis. So the models are kind of long-term, the epi is kind of short-term from what I've seen in the literature.
Yeah, and I mean, I would just add that, based on what I know, I have indoor PM measurements and outdoor PM measurements going at my house. So I'm watching this all the time, and the spikes, you showed this, the spikes are huge can be huge indoors. And those are very different chemistry too. So it's not just the, number that you're being hit with, probably a very small part changing at once. I mean, what do we know? Like, again, outdoors, I've seen these spikes. Sometimes they're metal incineration particles, for example, which could have, as you say, they're integrated, but how much do we know really about the health effects of what is really playing a role in terms of, it sounds like I know most of the measurements have been these integrated measurements over time, right? The short-term ones, especially with chemistry, are a lot harder. How much do we know about that as far as what's driving, what's the key for driving sort of the health effects that we see or know about. Does that make sense? That was kind of
Yeah, and I think other people on the panel probably know this work better, but I don't know that I have my finger on that part of the literature very, very closely. But I'm thinking of, sort of the diesel exposure, the diesel exhaust exposure type studies, a handful of people in a chamber with 4-hour exposure. I think there's a little bit of that out there, but I don't know the depths of that literature. Maybe others can comment.
I can comment on one aspect, and that's one of the challenges with thinking about indoor air is this question of timescales, right? So we're ventilating very quickly. And so what a lot of our established understanding of toxicology and epidemiology in terms of air pollutants is really focused on long-term exposure. But indoors, we can have short-term exposures, and then they can be temporally variable, as I think it's been really shown, and you can have a wind change and you suddenly have different events or wildfire smoke, and that's maybe days, but with short periods where it gets really high. And so that introduces a challenge in terms of thinking about health effects of time for exposure. And so we can think about acute effects, which are very short-term effects, and then long-term chronic effects. But in the indoor environment, we also have this very repeated exposure to short-term effects. And I don't think we really understand how those different timescales of exposure link to health effects, let alone how the concentration in chemistry impacts that. So I think there's a lot of room to think about that field.
Okay, thank you. So there's a lot, I have to say there's a lot. I'm sifting through the questions that are coming in, and there are a heck of a lot on the mitigation. Everybody wants to know about what's the best portable air filter. I have to say, as was commented, we have a whole workshop dedicated to that coming up. And so right now the focus of today is more on, what do we know about outdoor versus indoor sources. So I'm trying to keep the questions on that. And if you're interested in the portable air filters and the mitigation strategies, I believe that's the 28th. Okay, this will wrap us up. This is a pretty big one, so this will take us to the end. Are there any studies on 50 to 80-year trends of air quality versus human health and mortality rates? How much improvement has been made over the decades? Are we at a point of at best achieving incremental benefits, thus expensive solutions? I think the question is, how much do we know about how our air quality, both, so I would argue indoors and outdoors, but how much that is changing? And one of the questions that came to mind for me was, how do new houses compare to old houses? Brent, you showed huge variability for different houses, but I just kept wondering what's driving that variability. Is that an age issue? I mean, is there something you can correlate it to pretty easily? So let's just narrow this down, because we can answer this question for the rest of the time. So how have things changed for sort of, indoor air quality in the last, 20 years? Do we know, or are we just learning as we go?
Yeah. Okay. So so Charlie Weschler has a nice paper from about 10 years ago on changes in indoor air since the 1950s, which I thought was great. But things like more tighter envelopes, we started caring more about energy, right? So we have tighter envelopes. There is a little bit of tiny evidence out there that buildings get leakier over time. I'm thinking of one report from a group called South Face, I think. So in terms of outdoor infiltration, that's a key component. Of course, we've changed the materials we build buildings with too. Interestingly, in some of our field studies here, we found that some of the quite older buildings were easier to insulate and retrofit because of balloon framing, where you can actually put insulation up into the walls pretty easily, than some of the kind of mid-range buildings, if you want to do that. And in terms of the 50 to 80-year trends and so forth, I'm aware of a handful of studies that have done maybe 30-year backcasting, but then they rely on health impact function kind of estimates from general associations. So I'm not aware of much more there.
Okay, thank you. Delphine, did you want to jump in really quick? We're right at the break and where you have
Yeah, I just have to jump in because this question of long-term trends in outdoor air, we certainly understand the long-term trends of particulate matter. And we also have been able very clearly to link those outdoor trends in particulate matter to hospital visits, mortality rates, cardiorespiratory disease. There's really, really strong linkage. And it's very well established in the literature that reducing particulate matter exposure by even small amounts has very substantial health effects, which is why the Clean Air Act is viewed as one of the really strongest pieces of legislation in terms of extending life years of people in this country. And so that literature is very well established. The outdoor particulate matter, we understand. What we haven't been really thinking about for as long, we don't have 50 to 80-year trends on particulate matter in indoor environments. So that's the area where I think we do need to start extending our research. But expensive solutions, but the benefit is so incredibly strong because of this long body of outdoor atmospheric literature.
Great, thank you. Okay, I think we're a couple of minutes into our break time, but that was really useful. So thank you for 3 really excellent talks to get us started. I really enjoyed them. I'm learning a ton. And thank you to the audience for the questions. And we're going to take a break now. We have about 8 minutes left. I think I'm trying to see, David, are we coming back at 10? My California time is catching me. We reconvene at 12:55 p.m. So for those on the East Coast, or well, 12:55 p.m. Yeah, 9:55 a.m. for those of us in California. So, and then whatever time zone you're in, somewhere between those. So anyway, so thank you very, very much, and we'll reconvene in 7 minutes.